I see that event recording is in progress. Good morning. Today is July 1st, 2020, and this is our 11th in a series of calls for Medicaid behavioral health providers that seek to provide verbal updates on our response to the COVID-19 state of emergency and associated guidance. My name is Dr. Alyssa Ward. I am the Behavioral Health Clinical Director at the Virginia Department of Medical Assistance Services. We appreciate you being here with us today for this WebEx event, and due to the large number of participants, everyone will be muted today except for our panelists. We will not be answering questions about service flexibilities or Medicaid policies in the Q&A function of this chat today. We would like participants to take note that our hosts or panelists will be focusing on the facilitation of the presentation and not multitasking to respond to you individually. So, as always, we value your feedback and questions and want to make sure that we attend to them mindfully. So please send those questions to our two email accounts. Those are provided on your screen right now: enhancedbh@dmas.virginia.gov for mental health questions, and sud@dmas.virginia.gov for arts-related questions. Please reserve the Q&A function for technical and logistical questions today. It is always possible to listen to this event over the phone, but we encourage participation on your computers as we always have some slide content to share. I am joined today, as usual, by Dr. Cleopatra Booker, who is our Behavioral Health Senior Program Advisor, and Anna Shawley, who is our Support Act Grant Manager. Always big thanks to Laura Reed for the coordination and hosting of this event. So we can move to the next slide, Laura. On this agenda slide, I'm sorry, Laura, can you go back? I was premature. In our agenda today, we anticipate actually that this call should be fairly brief. We have one major clarification to review with you, and then some resources and one single frequently asked question to discuss today, given what we have seen come into our inboxes over the last 2 weeks. Next slide. We are now 4 months into the state of crisis related to the COVID-19 pandemic, and as of today, our Commonwealth moves into the third phase of reopening according to the governor's overall plan. Our call today will focus specifically on a memo that is imminently forthcoming that provides an overview of key changes to our flexibilities in one particular area, that area being the delivery of group-based services. We also have several global resources to share on this call, and we would like to begin the call with a reminder of where you can find the recordings of these calls on the DMAS website. That is on your screen right now. They are uploaded to YouTube and then posted on the website for your reference, along with additional resources related to our COVID-19 response. Next slide. Did want to mention to you all today that our telehealth survey does close tomorrow. So far, we have received 164 responses, and those are very helpful to us as we are working to solidify recommendations around telehealth policies ongoing from DMAS in the state of Virginia. The QR code is available here for ease, but we also have the SurveyMonkey link available here directly. Next slide. Just a quick reminder, coming from our partners at the Department of Health Professions, that there has been amendment to Executive Order 57. This amendment states that temporary licenses that were granted for the state of emergency will now expire September 8th, 2020. So during that time, when practitioners may have obtained a temporary license, they may seek a full Virginia license, or they can transition patients that they have been seeing under their temporary license to a Virginia licensed practitioner. This information is also available on the DHP website, and please contact them with any questions about these temporary licensures. Next slide. At this time, I'm going to hand it over to Dr. Booker to review these forthcoming changes that will be released in the memo imminently.
Good morning, everyone. Thank you for joining the call today. I'm just going to do a quick mic check again. I see somebody said they were not able to hear. Can you all hear me, Laura?
I can hear you, Dr. Booker.
Okay.
I can hear you.
Okay, great. All right. So what I'm going to go over right now is a fourth memo that will be released hopefully sometime today. If not today, definitely by tomorrow. This is primarily clarifications and changes regarding group-based service delivery and behavioral health and addiction recovery treatment services during COVID-19 state of emergency. Next slide. These changes affect members that are receiving services through fee-for-service as well as managed care organizations. So within the memo that will be released, you will see that there is underlined text in the memo that is including clarifications and changes from the text where we have released previous memos. The previous memos were released on March 19th, March 27th, and June 11th, where we specifically released the memo for behavioral therapy provider flexibilities. The primary purpose of the memo that will be released outlines allowances for the delivery of face-to-face group-based services. Next slide. Specifically regarding group therapy, DMAS will resume reimbursement for face-to-face delivery of group-based services upon the release of this memo. DMAS advises that providers should carefully weigh the vulnerabilities and benefits of resuming face-to-face group services. Group-based providers are reminded that they retain until further notice the ability to offer services individually or through individual or group telehealth or telephonic contact. Providers are encouraged to prioritize the health and safety of members and their staff and to consider member preferences, engagement, and optimum access to care. Providers who elect to provide face-to-face services should integrate guidance provided through the CDC, Virginia Department of Health, and any relevant licensing bodies. Next slide. Additionally, within that memo, it is noted that for TDT, intensive in-home mental health skill building, behavioral analysis, intensive community treatment, and psychosocial rehab, where we had allowed service delivery to be provided outside of school settings or office settings, prior to the release of this memo that is imminent, there was a 120-day limit there. We have now changed that and said that this is allowed for the duration of the state of the emergency. Face-to-face service requirements will continue to be waived, but documentation shall justify the rationale for services through a different model of care until otherwise notified. Providers shall maintain appropriate documentation if the plan to provide or continue care deviates from the normal protocol or plan of care. Next slide. These flexibilities that are afforded to providers are approved through a combination of state and federal allowances, and thus timelines for availability and the continuation of the flexibilities are subject to change, but it's based upon numerous sources. Just as a reminder, effective April 26th of 2020, the U.S. Department of Health and Human Services did renew the determination that there is a public health emergency that exists due to COVID-19. That public health emergency has existed since January of 2020 for the nation. DMAS will continue to monitor the renewal of this federal level public health emergency declaration that is set to expire on July 25th, 2020. On May 26th, the governor of Virginia amended Executive Order 51, declaring that a state of emergency continues to exist in the Commonwealth of Virginia, and that state of emergency shall remain in full force and effect until that order is amended or rescinded by further executive order. At this time, there is no expiration date for the governor's executive order. Next slide. At this time, I'm going to turn it over to Anna to go over our resources for providers.
Thank you, Dr. Booker. My name is Anna Shalley, and I am the Support Act Grant Manager. This morning, I'll be providing information on resources from DMAS and other organizations to help support providers during the COVID-19 state of emergency. Next slide, please. First, I'd like to remind everyone of the CARES Act provider relief funds for COVID-19 for those that have not received a payment from the Provider Relief Fund general allocation. HHS has allocated an additional $15 billion for these providers who participate in Medicaid and CHIP. The deadline to apply for additional funding is Monday, July 20th. We encourage providers to apply even if uncertain about eligibility. Please see HHS's recently updated website, the link on this slide, for more information about the emergency payments and for scheduled webinars about this funding. Next slide, please. The SUPPORT Act grant continues to offer various technical assistance opportunities for providers with our behavioral health addiction specialist, Paul Brassler, and our addiction medicine specialist, Mishka Turplin. We are taking a bit of a summer break for the next week and a half, but we'll resume Monday, July 13th with our monthly stakeholder meeting to review grant updates, and then several technical assistance opportunities that week, including a new topic addressing substance use disorder bias and building provider empathy. In collaboration with BCU Project ECHO, on July 17th, there will be an ECHO session on pharmacotherapy for pregnant women with opioid use disorder. These links can be used to register and access the events. Next slide, please. All of our technical assistance schedules can be found on the ARTS webpage. You will additionally find webinar slides in our resource library, which includes links to DMAS and SAMHSA guidance, resources for addressing racial and ethnic health disparities, naloxone resources, helplines, telehealth resources, and more. If you go to the DMAS website under Program and Services and click Arts, scroll down and you will find the SUPPORT Act grant section. Next slide, please. The Virginia Department of Health Project ECHO has one more scheduled buprenorphine waiver training scheduled for August 26th from 9 a.m. to 1 p.m. This online session will deliver the required live portion of the total training hours. Please see this link to register for this training. As a reminder, there is no charge for this. Next slide. We also want to provide resources for naloxone. There is currently a standing order in Virginia which allows Virginians to go into a pharmacy and request naloxone without a prescription. There are also several online opportunities to be trained in the administration of naloxone, including from the DBHDS Revive program and from the website getnaloxonenow.org. These are all web-based trainings. We also want to inform you of a program by the Virginia-based nonprofit, the Chris Atwood Foundation, who is providing free naloxone to any Virginian, regardless of insurance, via U.S. mail upon completion of this online form. Please note that this is the intramuscular administration form of naloxone. As a reminder, Medicaid will reimburse for naloxone. As per DMAS's memo dated March 27th, DMAS is recommending providers write prescriptions for naloxone to members in case of interruptions in community-based naloxone distribution due to COVID-19. Next slide, please. I will now turn it over to Ashley Harrell, our Senior Program Advisor, to review these frequently asked questions.
This is Dr. Booker. I'm going to take it over from here. Let's go on to our frequently asked questions, where we have two actually frequently asked questions. The first question is, can you review when the 1 unit maximum applies for audio only services? The answer is, if a provider is only providing services through telephonic audio only communications, the provider should bill a maximum of 1 unit per member per day, regardless of the amount of time of the phone call. Please note that this limit is only applicable to TDT, intensive in-home mental health skill building, ICT, and psychosocial rehab services. Other behavioral health and art services shall continue to follow billing practices for in-person face-to-face services as per the appropriate DMAS manual. Next. Question 2, when should we update an ISP or service plan? Answer. Please refer to the ISP requirements that can be found in the DMAS manual. Of note, though, The ISP is a regularly updated treatment plan specific to the individual's unique treatment needs. And as the needs and goals of the progress individual changes, the ISP shall be updated. The ISP should be defining specific steps and interventions that the provider and individual will engage in towards the attainment or achievement of their objectives. Note, if the interventions or steps to engage the member are changing, for example, if you are going in between face-to-face versus audio only or a combination of, and this was not previously noted as a specific step that is being used to obtain or get closer to the individual's goals, the provider should be updating that ISP to reflect those changes in the delivery of care. Please note that from the COVID-19 behavioral health and arts memos that have been released, it has been noted that providers shall maintain appropriate documentation to indicate the mode of delivery via telephonic or telehealth platforms used that are being used to support medical necessity for the ongoing delivery of the services through that model of care. At this time, that concludes our FAQ portion of this WebEx. There is mention within our Q&A portion that there has been hints from the federal level, HHS, that the extension for the public health emergency may be extended 90 days. At this time, DMAS is waiting on official notification from Health and Human Services that extension will actually occur. When that information comes into us, we will be sure to try to inform providers as soon as possible regarding any extensions around the public health emergency. At this time, this concludes our WebEx. We invite you to send any additional questions to our enhanced VH at dmas.virginia.gov mailbox. If you have any arts questions, please send that to our SUD mailbox at sud@dmas.virginia.gov, and we will be happy to answer those questions or respond back to you as soon as possible. As always, we thank you so much for your partnership, your support, and your participation, and I hope you all have a great rest of the week.